Hey guys, I'm back and we're going to talk about, do you really need to take hormones when you get older? Okay. Let's first talk about the basics of what a hormone is to make it really simple, because it's very confusing for people. Some people make it confusing, but it's very simple. You have the gland. The purpose of the gland is to make hormones. Hormones are communications. They're messages. They're instructions that tell the body what to do, and it travels through the blood. So we have the gland, makes the communication. Like right now I'm talking to you, you're understanding what I'm saying because you obviously understand English, but the words could be the hormones, they connect in your ears, you understand that, and then I can't really see you, but hopefully you are tracking with me. So what happens when that hormone connects with the receptor on the other end of the communication circuitry, then the function kicks in there and is activated. And then the feedback loop comes back around here, telling the gland that that function was complied with, and then the gland can stop producing that hormone. So we have this on-off switch going on. So the endocrine system is a superior communication system composing of glands and hormones and the coordination thereof. Okay? So you end up with low testosterone, low thyroid hormone, low estrogen, low growth hormone, and you're thinking, wow, I'm just going to take some bioidentical hormones because I don't have enough because I'm getting older, right? Well, the problem is there's side effects. And this question is never asked. Why does your glands stop talking in the first place? This is what needs to be looked at right here. Okay? Why do you have low hormones? Now, you say, well, I'm going to take bioidentical hormones because they're safer. Well, you know what? I'd like to see the study on that. There are no studies that I know of, unless you show me, that compare bioidentical hormones, like the risks, versus synthetic hormones. And we know that synthetic hormones have major risk problems. There might be some studies, but I've never seen any. So the point is that when you take hormones, it comes with a package, because you bypass your body's normal production and you make your body dependent on that hormone, okay, with a bunch of other side effects. And there's just not a lot of data known about taking hormones and what it does with the complexities of the interactions with your own hormones. So it's an area of unknown, okay? So let's just take a look at what could possibly stop your gland from talking, all right? You have counter hormones that oppose your hormones. So you have, like, insulin, estrogen, and cortisol are the big three hormones that can nullify and block other hormones. They have like dominating power. They can block the fat-burning hormones, for example. They can interfere with testosterone. Let's talk about insulin for a second. Insulin can increase androgens in women. That's like the male hormone. And that's why they can get a condition called PCOS, polycystic ovarian syndrome, when they get facial hair and they get hair loss, they get a deeper voice. But in men, it can lower testosterone. Okay, so low T, because they have high levels of insulin. But you can also, in men, you can have high levels of estrogen from consuming a lot of the chemicals in the environment, which can then block the receptor part right here. And that's called endocrine disruptors. If you do research on endocrine disruptors, you're going to find a whole bunch of data relating to certain chemicals in the environment, like pesticides, insecticides, herbicides, fungicides, heavy metals. Even if you look up a book called Toxicology, the Study of Poisons, it'll list tons and tons of research on the effects from endocrine disruptors and how it can affect your hormones in a big way. So let's say you consume regular foods that are GMO and you're exposed to an herbicide like glyphosate that's Roundup Ready, for example. That's going to affect your cells, and it can give you estrogen effects, okay, in men and women as well. So because of the amount of chemicals that are in our environment and the complexity of our own hormones, there's all sorts of things that can happen. You can actually have the gland enlarge, it can shrink, you can have all sorts of effects down here where certain hormones don't work. You can have a whole series of reactions that occur down the road that don't happen right away. They might take 13 years to develop. Okay, then you have junk food, okay, or alcohol, for example, that destroys the liver. And it starts developing a fatty liver. So if you have a gut, chances are you have a fatty liver. And if you have a fatty liver, you're not going to have the full capacity of liver function. And the liver is needed, especially to regulate a lot of these hormones, to act as a buffer and a reserve, and even the production of certain hormones. So it's very, very important, especially in growth hormone, which is the anti-aging hormone. And growth hormone works with testosterone. And then you have the thyroid hormone, which works through the liver. So if that liver is damaged, that could be the reason why you have low thyroid hormones, okay? And lastly, you have statins, which are drugs that block the body's ability to make cholesterol. Cholesterol is the precursor, it's the raw material that makes a lot of these hormones. So that's why one of the big side effects when you take statins, like Lipitor for example, is severe muscle pain, muscle achiness, destruction of the muscles. That's because it blocks the hormones, and then you start getting more inflammation. You don't have the testosterone now to build muscle tissue, and you start having all sorts of inability to develop muscle mass and a lot of pain as well. Now the big question is, what do you do? Well, instead of starting to chase around some of these symptoms, first get in the basics. I'm talking about a healthy eating plan, like healthy ketosis, and then intermittent fasting. Do that and see if that doesn't actually help your endocrine system right there. Chances are it will. But you also want to make sure that you consume a lot of cruciferous vegetables to clean up these endocrine disruptors and help your liver as well, okay? The other thing that you can do is search out a high quality glandular supplement, okay? Make sure it's grass-fed to support whatever gland that is not producing or not working in your body. All right, so thanks for watching, and I will see you in the next video. Hey, I appreciate your attention, and if you're enjoying these videos, go ahead and subscribe, and I will definitely keep you updated on future events, live events, and webinars that we're going to do very soon.